Hello, my name is Mingran, and you can call me Anna, and currently study Bachelor of Nursing in Western Sydney University.
So, Anna, I'm just going to ask you a few questions.
Yeah.
So the first question is, considering the NMBA standards for practice that govern your nursing practice, how will you deal with the following situation? It is your first rotation as a new graduate nurse in the cardiac unit. You responded to a patient call. When entering the room, one of your patients is short of breath, and another patient who is diabetic was feeling lightheaded and sweating profusely. How would you handle this situation?
So it is essential for me as a new graduate nurse to think critically and analyze nursing practice. In addressing this situation, I believe both of patients are quite critical and require urgent timely management and care. I will first of all call for assistance or even the arrest buzzer, depending on my quick assessment. As there are two patients that need attention, I will attend to the patient who require more attention at the time of assessment. I will approach the patient who is currently having shortness of breath by placing oxygen to the patient or prescribed medicine such as asthma inhaler, pumping the patient up high to maximize their breathing potential, and then move on to the diabetic patient. While the assistants are arriving with the equipment and arrest trolley, I will alert my colleagues that I also require a blood glucose monitor to be brought into the room. I will commence by beginning to check both patients' level of consciousness and the vital signs, using my newly learned A2G assessments. Depending on the patient's alertness and the requirements, I will attempt to delegate and allocate my colleagues and request them to take over one of the patients while I can concentrate on the other. I will give them a quick handover and then focus on the patient who have a short of breath. Look and listen for patient's airway and appearance. If they have no obstruction in airway, depending on their vital results, I will hook them up onto an ECG monitor and potentially a non-rebreath mask if required. I will ask my senior nurse who in charge and call repeat response if necessary. In addition to this, if I was able to manage and everything under control, I will communicate with my fellow team members regarding the status of the diabetic patients. According to patient symptoms, lightheaded, profuse sweating, it is potentially caused by low blood sugar. Depending on their blood sugar level, I will provide some sweet food such as apple juice, lemonade for fast-acting sugar, and followed by some of carbohydrates, or tap into the Hypo kit. Once they feel slightly improved, I will inquire or ask the patient whether or not she or he have eaten recently and the amount. Continue to monitor their signs and regular blood sugar level until stable. I will look into their medication chart to assess if they have taken any hypoglycemia agents and request for clinical review. I will continue to communicate with my colleagues regards to their condition and document accordingly when both patients are stabilized. Document all the care to the progress notes. Have debriefing session with nurse in charge if required. Hand over to the next shift, and I will reflect on any improvement or potential skills that I may utilize if I was placed in for a future situation.
Okay. So the second question is nurses must comply with work health and safety standards. Describe a conflict situation you have been involved in your undergraduate nursing practice or as a nursing student. What did you do? What was the outcome and what would you have done differently?
It is essential for me to deal with difficult patients by showing respect, being patient, and responding to their needs. Once encountered a patient when I was a student nurse, I found it difficult to get the elderly patient who I was caring for to cooperate with me. She refused to take her blood pressure medication, and she mentioned this morning her blood pressure was in the normal range, and this medication will make her blood pressure drop down, make her discomfort. So she doesn't want to take this medication. I indicated that I could understand about her concern and explained that she had a medical history of hypertension, and doctor charted the regular blood pressure medication is helpful manage the blood pressure. If don't take the medication, may have a risk of hypertension later. I checked the morning blood pressure record, and it is safe to take this medication. After educated, patient was understood and happy to have this medication. Gradually, the patient settled down and started cooperating with me.
Okay, so the last question. The completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a time of lifelong learning and autonomy. After obtaining employment, what is your short term, so within the next 6 months to 1 year, and long term, within 2 to 5 years, career plan and commitment to professional development?
When imagining what I want for my life and the career as a nursing student, I began to develop such a plan. I treat every position and action as either pushing me closer to my goals or further away. For example, taking a position simply because of location, salary, or workload will not necessarily help in getting me to my goal. My most current one-year nursing goal is to work as a nurse with a government, non-government, or private organization. The first step I will need to take in order to reach my goal is to dedicate myself to working and learning as much as I can from my colleagues and the nurse managers. While working in a facility, I will need to challenge myself by understanding the various way medical emergencies are addressed. Step 2, acquiring the technical skill along with communication, development, constant environmental change, and networking will be useful for my 5 years and the long-term plans. The third step, I will want to take any necessary or expected formal trainings that would improve my skills and make me more marketable to organizations. In 5 years, I would like to be the most valued nurse on your team. I plan to take full advantage of the continuing education you offer to expand my skills beyond their current level. I'm skilled in patient education and EMR, which I know you value. There are so many new skills I would like to gain, including budgeting and training. Other commitment to professional development is a vital part of my career plan. I'm working as an AI in 1.5 years. I'm open to opportunity along the way, but will take every position with a consideration of how it will affect my 5 years plan. Thank you.
That's okay.